Hello everyone and welcome to the NADA Rural and Regional Networking Forum. My name is Robert Sterling and I'm the CEO here at NADA. And so I'm just trying to work out how to... I'd like to start by acknowledging the traditional owners of the land that we're all meeting on today. For me, it's the Gadigal people of the Eora Nation, and pay our respects to elders past, present and emerging, and any Aboriginal people joining us here today. So today's forum has come about in response to our feedback from members about how we can better support our regional and rural members. And so we're going to hear from some members across the state, and then there's going to be an opportunity for you all to talk about how we can better support each other and how NADA can support you. So I'd like to start by introducing the panel members. So can we start with Frances?
Hi, Robert. Thank you. I'm Frances Pidcock and I'm the Community Outreach Manager at the Buttery, and we are a residential and community service program that provides drug and alcohol, gambling and mental health support in northern and mid-north coast of New South Wales. The reason why this is important to me is because I understand that this is a significant issue that impacts access and equity for our participants. And I also feel that it puts them at significant risk from anything including relapse to risk behaviours such as hitchhiking.
Thank you very much, Frances. Michele? Hi,
Michele Campbell from Lives Lived Well. I'm the Regional Manager for New South Wales. So I look after services in Orange, Dubbo, Lithgow and Katoomba. And we also have services in Bega, Nowra and Wollongong across the state. So I think this forum's important as it's a good way of sharing information and how we overcome these obstacles, because all of our clients travel from statewide. We get a lot of North Coast clients from further out west who have real difficulties getting to us, or also when they leave, it can be a difficulty as well. So we want to help overcome those barriers.
Brilliant, thank you. And Raechel?
Hi, my name is Raechel Wallace. I'm the Aboriginal Program Manager at NADA. I also sit on the New South Wales Aboriginal Drug and Alcohol Network Board, and I'm also work with Lives with Wells. Why this is important for me today, this forum, is I used to work in rural communities. Transport was such an issue for us, the complexities of transport for our clients. So for a service provider finding it difficult, just how much more difficult it would be for our client group.
Thank you very much, Raechel. And we hopefully will be joined also by Norm Henderson, who's a senior AOD worker for Weigelli Aboriginal Corporation just outside of Cowra, and hopefully Norm will join us shortly. So I'll just go back to sharing the screen. So yeah, so today we're going to talk about understanding some of the challenges for rural and regional services, and we specifically chose transport because we know that transport is one of the biggest issues that our members face for their services, for their clients, and also for their staff. And hopefully we're going to share some learnings from each other, and then also enhancing our professional relationships and knowledge sharing, and create a network, a stronger network of our regional and rural members. I mean, I know that most of our regional and rural members already network really closely together because they need to maintain their services. And then finally, we talked about that opportunity for you all to provide feedback to NADA about how we can support you better. So I'm just going to bring up a map. Sorry, I need to stop sharing this. Can you all see that map?
Yep.
Yes.
Okay, sorry, for some reason it's not working properly on mine. Sorry, I just stop sharing again. You'd think after all the months that we've been doing this that I would have gotten better at this. There we go. Sorry, there we go. So Rose, our Research and Data Management Officer, has been getting very good at these Power BI graphs. So basically what you're looking at now is a map of all where our members are located across the state. And so what I might do is just click on North Coast. And of course, this worked perfectly when I was testing it beforehand, and now it's not zooming in onto North Coast. Okay, so we might need to come back to it. So essentially what I was going to show you, there we go. Sorry, there's just a bit of a delay. So here I've just brought up where Francis is located, where the Buttery provides services. And so you can see 3 dots there. So 2 smaller dots and then a larger dot. And so the larger dot represents a number of services. So we've got 2 members located in Coffs. So there are some issues in terms of the data, because we know that services like the Buttery actually provides a lot of services in terms of their travel across the state. And so what NADA is working to do is improve our member database so we can better capture where our members are providing services across the state. So I'll go to Western New South Wales now. We can get an image of where Michele provides services and also where Norm provides services. So you can see Western New South Wales is a huge space to cover, and the services are sparse. And then finally, where Raechel is located, which is not going to give you, so I did check on this before. Oh, yes, we do. So there you can see where Raechel provides services on the south coast, and heading further south. I know that services are provided in Bega, but they're not getting picked up on our map, and we absolutely need to get better at being able to showcase where our members are providing services. So another rationale for this. So these are some comments from members from our last member survey, and really it's the motivation for why we're quite a few comments from our members that are calling on NADA to provide more training, to provide networking, and to look at addressing barriers for clients coming from regional areas, including transport. In terms of what support NADA has available to our regional and rural members, so we do prioritise training grants and other grants for regional and rural members here at NADA. We also provide access to travel and accommodation support for members to attend training. So over the 12 years that I've been at NADA, we have tried to hold training in regional and rural areas. And I guess as you showed from that map with the services in such locations from far away from each other, it's really challenging for us to hold training in a particular area and get the numbers needed to justify the costs. But that's not to say that we're not going to try it again. It's just that that's why you haven't seen so much training being provided in regional and rural areas. So what I do want to say is that site visits. So NADA has a multidisciplinary team, and I do encourage you, if you want a NADA staff member to come out to talk to us and let us know what your needs are. We have a consumer engagement officer. We have Raechel, our Aboriginal program manager, our clinical director, Susie, and Michele, our clinical program manager, and other staff who can provide support to you. So please do get in contact if you'd like a NADA staff member to come out and visit you. In terms of advocacy and representation, NADA contributed to the inquiry into regional, rural and remote rehabilitation, which was then followed by the Special Commission of Inquiry. And more recently, there's another New South Wales inquiry for regional and rural New South Wales, which is looking at health access and outcomes. And so NADA's just responded to that, basically providing our original submission to the regional rural rehabilitation and drawing their attention to the recommendations from that report, which still haven't been implemented by the New South Wales government, and basically calling on this inquiry again to ensure that the government respond to those original recommendations. And then lastly there, we have just been successful in getting a small grant in partnership with the Aboriginal Drug and Alcohol Network to establish some regional Aboriginal worker networks. And perhaps I might get Raechel to talk a little bit about what that might look like and how we'll be engaging with our Aboriginal workers shortly. But now I'll stop sharing this screen and I'll hand over to our members to talk about their experiences. So I'll hand over to Frances first.
Thank you very much. So the question put to me was, what's the key transport issues for our service staff and clients? And I wanted first to just talk about why it is that this is an issue for the clients of our service. And I suppose what I'm seeing is that there's actually a lack of access to motor vehicles, and that might be due to lack of financial means, unable to afford motor vehicle costs, registration, maintenance, etc., petrol, or it also might be due to our participants being unable to actually hold a driver's license due to fines or charges, etc. And so there's a real heavy reliance on the public transport system, and that is a big problem in really remote areas where, for example, buses may only come during school hours. So you might have 2 buses a day. It won't fall in alignment with appointments, etc. Leaves people stranded for hours. And the other issue that's really come up for us of late is actually the impact that the NDIS has had on our participants, where they may have sourced transport either financially through Centrelink or actually physically through community transport. These doorways are closing to them, and if they don't have an NDIS package, and it's difficult for people who have an alcohol and drug issues to get an NDIS package and then have the community transport built in there. We are seeing in our organisation there are governance issues in terms of actually motor vehicle transport, garaging, etc. And even the little things that you might not even think about, such as assisting a participant to access a GP or specialist appointment, and the insurance limitations on being able to actually have that participant take their new baby or infant, etc., in the work car. So that's a bit of a problem too. And for staff, no doubt, it's a massive safety issue. We have our staff driving around in little cars on highways and windy streets in remote areas, and the chances of accidents, etc., are really high. So they're the sorts of issues that we're seeing in transport.
Thank you very much, Frances. I'll hand over to Michele.
Okay, there's a lot of wide-ranging implications around transport for a lot of our clients. We actually did a focus group at one of our residentials to get a bit of an insight into transport for women in particular, and the vast majority of the clients coming in don't have access to their own transport, so they're reliant on various forms of transport. So that usually involves at least 2 or 3 different sorts, like a car, bus, train, to get out to us, which they find quite daunting. Often they don't have money to get that transport as well, which can be a problem. They're not confident in accessing transport by themselves to go somewhere that's unknown. So that's where often staff from other services will transport people out to us, and we get linkages that way, which is really helpful. Sometimes our continuing care workers will actually go out and collect people, if that's feasible as well. But obviously we need 2 staff to do that, so it's not always practical. In Lithgow, for example, as we outreach to Portland, which is around 2,000 people out there, bus fares are quite expensive for people. There's 1 bus to and from each day, so if they miss the bus, they might be stranded in Lithgow and not be able to get back. This is obviously for community-based services. People have lost their licences or they're intoxicated, so they can't drive into town, things like that. Often they get transported by family or friends, and then that obviously impacts on a wider range of people if they're waiting around to take them back again as well. Interestingly, in Dubbo during COVID, we found that our clients that were, because we went completely virtual in our community-based teams as well as residential for a while, we found that the engagement of Aboriginal clients was a lot higher. So our via phone contact, and part of this is related to transport issues, we went up to 90% of the clients accessing services were Aboriginal for the Dubbo outreach services, which has been maintained post our COVID shutdown. But that was interesting to note around the transport as well. So that's about it. And I'm sure Raechel can go into what happens around Bega, because there's a whole range of other issues around that area as well.
Thanks, Michele. Raechel?
Yes, I was going to talk about Bega. So I used to manage a community-based drug and alcohol service down on the far south coast, and the closest kind of, you know, residential services to us in Bega was like a minimum 3.5 hours away. A lot of our clients wanted to go to like Aboriginal residential rehab services. So the minimum travel distance for that was 6 hours. So for us to transport them there. So also transporting to detox and lining up the detox, which was really good when they were going out to Weigelli because we had the Linden withdrawal unit. But that meant transporting clients from Bega to Orange. And a lot of the time, a lot of the roads along on that trip there was no service. So we're transporting clients that would be, alcohol was one of the drugs of choice. So driving a long distance with no service on your phone. So it was workers having to stop at, you know, each town, checking how their client was going, see if they were feeling well before they continued on with that trip. Because it's a long way. So us transporting our clients, so we were lucky to have funds that would help us support the clients' expenses to transport clients. So if we wasn't able to transport those clients, they would have to do public transport. So it would be a 6-8 hour trip to Sydney. Then once they reach Sydney, there'll be another 4 hours out to Orange, so on a train. So it's a long way to travel. So I think the distance. So speaking to some of the Aboriginal workforce, they're talking about, you know, the distance they've got to travel to get a client to detox, and then also from then supporting their client, picking them up from detox, and then further transporting them to a residential rehab. So it's taking workers off the ground, and yeah.
Thanks, Raechel. And certainly, I mean, Norm's not joining us today, but I know in the discussion that we've had has had very similar issues out at Weigelli in terms of picking up clients from Nepean Hospital and having to drive. So there are lots of really similar issues happening. So Fran and Francis, you talked about before about you know, some of the safety issues with staff. So what I won't put anyone on the spot. I'll just put it out to all three of you. So what are your services doing to support your staff? What are the types of policies and procedures and other processes that you have in place to support your staff to respond to some of these issues?
Well, in terms of safety, we have good clinical governance, and we have quality assurance committees, and we have our policies and procedures very clearly, and we have online updatable outreach manuals, etc., to guide. We're looking at the implementation of an app that allows staff to be able to swipe in prior to ignition of cars, that will be able to then input details, and that will take care of things like servicing, you know, kilometres, as well as also it gets some data such as safe driving, etc., etc., and it also lets you know exactly where that staff member is at any given time. And also we're looking at rolling out a safe driving course throughout the organisation. So of course that's for community workers. I mean, we have some workers who work as far as out to Tabulum, we have Tweed Heads, and we have Kempsey, Bowraville, etc. So we have some staff that are on the road, quite unsafe roads for lengthy periods of time, and also fatigue is a big thing too. So we really encourage staff to take care of themselves and make sure that they're feeling well before they provide support and get behind the wheel.
Great, thank you. Michele or Raechel, is there anything else in terms of, you know, other support mechanisms in place for staff?
We have a calling system where we've had navmans and things in cars, but we no longer use those. And we used to go out a lot further west, so regularly have staff travelling out to Broken Hill and Burke, Walgett, Campbell, all those sorts of places, which is when we had the navmans. But we usually it's a call-in system. If they're by themselves, they're generally not transporting clients. If we're transporting clients, we always try and have 2 staff members.
Great. So what advice would you give to other regional and service providers based on your own experiences in responding to the challenge that Transport have for your services? Is there any advice that you would give to other NADA members based on your own experiences?
Yes, I would. I mean, I think one of the important things is to take it into consideration when you're building the service delivery model and actually responding to tenders. I really, you need to build this in, and that gives staff members space to be able to actually use some of their service delivery hours to actually get out to those remote places. And when you get there, you need to go there frequently. You need to be a presence. You need to not just go there once a blue moon. So I think actually building it and considering it strategically in your service delivery model will be very helpful. Some of our programs are built so that we can actually go out to some of our newer programs, particularly the service delivery model is built so that we have the time to actually drive to remote places to deliver a service, and other programs are built so that we can have the capacity to pick participants up and bring them in. We can also provide things such as buses as well for some of our day programs. We can do that as well. So that's really important, but you need to have that built in so that it meets the KPIs. And then also some brokerage too, for consideration for fuel vouchers, etc. Like things like that really go a long way.
Great advice. Thanks.
Yep, I agree. That's pretty much what I was going to say with it. It's particularly the brokerage is really helpful to have that built into your budget.
Right. So what about, I mean, we don't have any funders on here. This is a member forum, but if say that you had this dialogue with funders, this is an issue for regional and rural services, what would you tell government?
I think one of the most interesting things for me is to look at the evaluation of the different programs. And so one of the programs that we have, which is the C program, that allows us to actually travel great distances to actually get in on country and actually serve people. And the number of Aboriginal and Torres Strait Island identified participants that we have in that program is between 30 and 45%. So I think data like that speaks for itself. That if we sit in an office with 4 walls and wait for people to find their way to our office, we're going to miss out on a whole load of people that can benefit from our support. And that's an equity and access issue.
Absolutely.
Michele?
Michele?
Yeah, I think practice-based research is very important as well, and to provide that evidence that going to the people works.
Great, thanks, Michele. Raechel, any advice for funders or government in terms of policy?
I'm not sure with policy, but yeah, with the funding especially, and building that in, as Francis said, into your funding applications to be able to support with transport.
Yeah. Absolutely, I totally agree. And I know in some of my discussions with Norm, some of those challenges around purchasing, the ability to purchase vehicles through your government contracts is really limited. So people are having to go into, leasing arrangements, which aren't particularly ideal because, in terms it would be far more cost effective for the services to be able to purchase a vehicle. So I know that they're kind of some of the challenges that we would say to government is to change some of those contractual requirements for services to be able to purchase buses and things like that to further support transport. Okay, so Raechel, I mentioned the regional Aboriginal networks. Is there anything that you just wanted to add on the discussions with ADAN on establishing those 4 regional networks?
Yeah, so I think that's regional networks was something that ADAN did a long time ago to support Aboriginal drug and alcohol workforce out in the regions. So going out into regions, holding small forums. So with my work starting at NADA, starting to talk to some of the Aboriginal staff across our member services, there was a real need for that kind of support network to bring Aboriginal workers together to provide that peers kind of supervision and support to one another. So that's when we had a discussion with ADAN, and we partnered up with ADAN and we applied for some funding and we were successful. So we were going to commence in the new year, commence some regional forums, and we're going to base the regional regions on the AHMRC regions. They've got 4 regions across the state. So that will be happening in the new year. So watch this space. I'll definitely getting the message out to services.
Brilliant. Thank you so much, Raechel. So is there anything else? So we might wrap up this part of the session with the presenters and we might open it up to some of the attendees that we've got online. Is there anything that the panel members would like to add that they haven't had an opportunity to talk about in terms of the issues that members have with regards to transport?
Only just that it has a big flow down effect, because the transport system makes it difficult for people to seek treatment, and therefore their recovery journey is impacted, and that impacts their families, the staff that provide their service who watch and have limitations to what they can do, and the whole community.
Right, thanks, Frances. So yeah, I mean, I guess, you know, going back to the inquiry that I was talking about before, I mean, one of the main things, or I mean, there were lots of recommendations within that inquiry that would go to support, you know, not just transport, but part of that is around access to services and increasing the availability of services across the state. I mean, I think, you know, for someone who's living out in a real remote area, to not be able to access treatment is a real shame for this state. So what we might do is open it up to participants now. So what I would encourage people to do is to raise their hand. So if you hit on the, I think if you hit on the participants button, there's an option there to raise your hand, and that will enable Maz to be able to let you come in to ask a question with the panel. Don't be shy. So that can be about transport, but I've also got some questions just generally in terms of how NADA can support our members. So, I mean, so this is one mechanism, and we know that some people like to engage in this type of way in terms of online forums, but what we're really interested in is this, you know, is a regular regional online forum like this useful? Or there are other models that we should be looking at to bring together our regional and rural members? So I'm really interested to hear your views about how we can do better to improve the support for our regional and rural services. If you don't feel comfortable raising your hand, oh, there we go. I can see some people have raised their hands. Helen, welcome. If I can get you to unmute.
Yes. Hi. I mean, I just really wanted to say, yes, this type of forum I think would be really useful. And I agree with all the points that the panel's made about regional rural services and transport. Great.
Thanks, Helen. Is there anything else that you can think of, you know, outside of, I mean, some of our members have talked about bringing training to regional areas. And so is there a particular locations where that's needed more than others that NADA could be looking at, or is there any other type of mechanisms of support that we can provide?
I think, yeah, bringing training would be good, definitely, within the capacity that you have to do that. I think learned some lessons through COVID in terms of Zoom and sort of being able to sort of extend support virtually as well. So we'll carry some of those lessons forward too. Absolutely. But definitely that would be helpful. I think I can't think of, in terms of the programs that I see that are regional, that it's similar issues in the areas. So I can't sort of pick out one. And when I hear other people talk, it's the same issues across as well. So yeah.
Great. Well, thanks very much, Helen.
Nothing particular stands out at the moment, really. But staff safety as well, because in terms of, in some of our areas, we actually don't have the capacity for 2 staff to go out. So we kind of have to juggle eggs, I guess, and sort of look at alternate locations, like meeting in the community where it's, you know, there's other people around, that kind of thing. It's a bit of a juggling act. So I think staff safety, I think, writing things into funding agreements is really important upfront, like taking all of those things into consideration as well.
Absolutely. And you're right, Helen. I mean, that is the reality for a lot of our services that are under-resourced, and really just looking at innovative ways to make sure that they can provide safety for their staff as much as possible, and also for the clients. So yeah, absolutely.
And also the driving safety in terms of kangaroos and in small cars has come up as an issue as well. So yeah.
Absolutely. Thank you very much, Helen.
Thanks.
Okay, the next participant. Hello.
Hi.
Hi, how are you?
Yeah, good, thanks. This is Janaya. I'm working with I'm working for Triple C program, and I'm actually coming from Murrumbidgee in Wagga Wagga. I just wanted to just bring an awareness, and I do agree with Michele, Francis, and Raechel, and also you know what Helen has said as well. I just want to raise as well that sometimes we don't have the capacity. I'm on my own at Murrumbidgee supporting AOD clients. But what I find out in terms of transportation is while some of my clients are willing to use transportation, I find that it's really, really scarce. So they don't really, especially coming from remote area like Cootamundra, Coolomon, wherein, you know, they only run, you know, one in the morning and one in the afternoon. So if they've been offered treatment assessment to come into Wagga Wagga, they missed it altogether. So I find that, you know, that's one of the challenges, I suppose, because they don't run very often. And also if they have to arrange a community public transport, it's a little bit of a process because they have to ring and fill in a form and then make a booking. So that can present quite a fair bit of a process. And also, especially when they've been offered a time, some of the time, especially with psychiatric assessment and other assessment treatment that's related to a specialist, I find that a lot of my clients find that a little bit tricky and challenging as well, while some of them are willing to actually, you know, do it on their own, you know, and that's part of their recovery and they wanted to do it. It's, you know, yeah, so I just thought I'll bring that awareness while, you know, it's nice to have the brokerage and, you know, being able to be picked up by staff member, but at the same time, sometimes there are the things that they wanted to do as part of their recovery journey in you know, obviously working towards their AOD.
Thank you very much, Daya. And is there anything that you think of in terms of bringing our regional and rural members together? Is there anything that can support you in your region in Murrumbidgee?
It would be really good to also have that, I suppose, you know, having that extra funding for people that has the resource for transport. I find that some of the people who actually can do transport people, some of my clients most of my clients doesn't have NDIS, and I feel that there is a gap in there. They're not, obviously they can't access that resources because they don't have NDIS. So it will be really good, yeah, to have that kind of support and help and extra funding.
Right. Thank you very much. And yes, I know Michele has been, you know, navigating the NDIS system is a challenge, and you know, for us as professionals who work in this area to find it challenging, I can only imagine how difficult it is for our clients. But I know that there is movement to make the NDIS more inclusive for people with coexisting alcohol and other drug issues. So we have another person. Hello, Oliver.
Hi, how you going? Oliver here. I'm from Freeman House in Armidale. I just have a general question for the panel and perhaps other participants as well. Wondering, is there any existing sort of either government or Centrelink, or are there any sort of funding streams or potential resources on a sort of an estate level that can be accessed for even for sort of material aid or brokerage in terms of accessing the public transport that might be available? Like, we're pretty fortunate here in Armidale. We've got a daily train in and out and an airport. So participants coming and accessing our residential service, but sometimes we have challenges in terms of returning home, whether that's on particularly this time of year, going and visiting family, Christmas and things like that, or even once they've completed treatment, getting home. I'm not sure if there's any existing funding there, or even sort of government funding streams or applications that could be made at Centrelink for travel needs of that nature, coming to or from residential drug and alcohol treatment.
Michele or Francis, have you heard of any type of schemes that might be able to support the clients from Freeman House?
Not that I'm aware of, no. It was a scheme a few years back that was around transporting people from custody, but not from rehab.
There used to be a Centrelink mobility allowance, but I believe that has ceased in the light of the rollout of the NDIS. So I think that's, really sort of been a block for many people. So I don't know anything current, no.
And in terms of brokerage funds, so do the Buttery or Lives Live Well have brokerage funds that they're able to access to support their clients?
The Buttery's got a lot of outreach programs, so we can rely on our own outreach programs for facilitation. And so some people on the waiting list, for example, they might be on the waiting list for an outreach program and they've actually decided to perhaps enter a residential rehab. So even on the waiting list, we will pick people up and transport them hundreds of kilometres to residential rehabs. So that may not be the Buttery either, it could be anywhere. So we definitely go above and beyond. And in some programs, we do have a little bit of brokerage, but it has to be negotiated with the funding body at the very beginning for things like fuel cards, etc.
Okay.
So on the South Coast, sorry, you go first, Michele.
All right. We have our women's program has specific brokerage, which was funded, and our Katoomba day program also has brokerage, and that's often used for cab charges to get clients to and from service as well. But other than that, it's staff doing transport in some cases, particularly to residential services if needed, or back to the station when they're leaving.
Sure. Raechel, what were you going to?
Yeah, I'm just aware of a brokerage program. It's not going to help you, Oliver, because you're out in Armidale, but on the South Coast, Waminda Aboriginal Health and Welfare Service has a brokerage program in partnership with all the Aboriginal community controls and the services on the South Coast. So if it's an AOD client, they'll support with any kind of cost to help a client get to residential rehab. So, yeah, or any other expenses around that. So that program's available down this way.
Fantastic. Thanks everybody for your responses.
Thanks, Oliver, for your participation. And the next person, Kath, welcome.
Hi everyone. So I'm from Morrimar Health Aboriginal Corporation in Broken Hill. So when we talk regional and remote, we're talking remote.
Very.
I suppose it's more of a comment, although I will just go back to say that the Commonwealth does have integrated team care funding, which I suspect is through most people's PHNs, to access for transport to and from appointments or to and from care. But I know in Western New South Wales, you have the patient has to have a chronic disease to access that funding. So as long as they're Aboriginal but have got a chronic disease. So I don't know whether that helps Oliver out at all with his transport issues. My comment was more around transport generally in remote and very remote New South Wales. Public transport doesn't exist. And so when we're talking about patients who've got to come from Wilcannia to Broken Hill, it's 200 Ks, we're talking wildlife route. And I think that there's a real sense that it's a given in New South Wales that public transport is an option, and it's not. And so it means that organisations like Morrimar part fund with, say, the Department of Transport, a daily bus out of Wilcannia into Broken Hill. But I think that the key is that all organisations who patients or people would be using that access that bus know that the patients will be in Broken Hill for a set 2, 3, 4 hour period of time.
Right.
And so when you're getting an appointment at the Broken Hill Mental Health and Drug and Alcohol Service for a patient from Wilcannia, they know to make that appointment between 11 and 2, so that the bus is an option for those patients. They don't make those appointments at 9 o'clock. So it's about relationships. I think that's partly what places like Broken Hill and Wilcannia, Menindee, Ivanhoe is 3.5 hours away on dirt. And there's certainly no bus. There's not even a part-funded bus. That is by car, and that is health workers driving patients to your appointments. And there's all added costs on that, because that, say for Ivanhoe, that's an overnight stay as well for the health worker. So it's the time away from their family as well as the patient. So I suppose it's just that concept that transport, sometimes public transport doesn't exist. And so it's working around what that might be. And in Morimar's case, that's about taking health workers off the job to sit in a car to drive a patient to their appointment, because we're about holistic care, and actually got 2 hours in a car with a patient. Wonder what you can get up to talking to about them in that opportunity. So that was just my comment.
Absolutely. Thank you so much, Kath. And it's, yeah, really great to hear about the innovative approach that our very remote services have, and that reliance on collaboration and partnership is absolutely something that we hear from our regional and rural services. As you know, totally necessary. And yes, we also hear, yes, it takes staff out of the office, but we, you know, that opportunistic approach to have a therapeutic intervention as part of the transport, we know is I guess one of the only possible benefits that we have from transport. Do any of the panel members have anything to make in terms of Kath's comment around those collaborations and other partnerships that are really necessary for the services that you provide as well?
That it's really important to work with your stakeholders as well as other agencies in the regions that you're working in, because we can all help each other.
Absolutely.
I agree, the partnerships, yeah.
Okay, so look, I mean, this has been super useful, and we will write down like just a brief 1-2 pager on some of the key points that came out of today, because I think it's really useful for NADA to document this so that we can communicate back to our funder as well, who is your funder, on some of the key issues that are, you know, happening for our members. But again, I would like to come back to talk about how we can support you more. And that might be that, you know, we have another one of these on another issue that impacts on regional and rural services. So I'm really open to hearing what is useful for our members, or if there's any particular type of advocacy that we should be doing on your behalf that's unique to regional and rural services. So I again encourage you to raise your hand, or you can write in the Q&A function if you don't feel like unmuting yourself. Welcome to take questions through the Q&A function as well.
Rob, I think another real issue in drug and alcohol in rural and regional, rural and remote communities is recruitment and retention of AOD workers. So
absolutely, and that, yeah, again, is something that we hear, and we know that during COVID, that problem became even worse. So what are some of the strategies that you've employed to try and overcome that? Have you got any innovative and creative ways that you've been able to recruit new staff or retain existing staff?
No, so we would recruit staff, but we couldn't keep staff, because a lot of the times we were bringing them in, they were coming from other areas to fill positions, and yeah, a lot of the times they didn't stay. So we actually, in the end, we worked in with a training provider, got the training provider to come and deliver the Cert 4 in AOD in the community, actually. So
great.
In the Bega. So we actually trained up local people to get a Cert 4 so they can move into the positions as they become available.
That's great. And how was that funded, Raechel?
At the time we were Linden, so Linden actually funded, supported that. So,
right.
Yeah.
That sounds like a great initiative to bring the training to community. I mean, that's fantastic. And
it's not harder now. Like a lot of our TAFEs are not offering that qualification as far. Like they are offering the qualification, but it's not as available as it used to be in our smallest area TAFE. So
absolutely, and that's absolutely what we're hearing from our members as well about that availability. Francis or Michelle, any creative ideas for recruitment and retention of staff in regional and rural areas?
I'm sitting in Katoomba today because I'm looking for a team leader. So it's
so
really
you're open
difficult.
to ideas.
It's really difficult. We search far and wide, but other than growing people from within, which is always, I think, a good option if you can. And investing a lot in your workforce, it's difficult, particularly to recruit RNs in rural areas, even in Sydney in some cases. But yeah, it is difficult.
Thanks, Michele.
I love what Raechel said about actually bringing the training to the community. That's so fantastic. I think that during COVID, having community outreach programs where there's a lot of isolated staff has brought about a lot of advantages where we've sort of, you know, gone electronic and we've come up with sort of creative, innovative ways of staying in touch with each other.
Mm-hmm.
I think that's been really, really helpful. And then just making sure that you know, you're getting your appraisals in, you're making sure that, you know, staff goals become your goals, and, you know, you're dealing with little problems before they become big problems. So clinical supervision, external, group, individual, all that sort of really good stuff. Great HR department, all that stuff is really, really helpful for retention.
Right. Thank you. So we've had a comment from Emma. She said it'd be great to have regional and rural specific webinars and opportunities to network, and we are absolutely more than happy to facilitate that as well. And I'm just thinking about, you know, the idea that Raechel just had around bringing the training to community. I mean, our training grants program is open. Our workforce development training grants program closes tomorrow, and we do encourage services to put in joint training application, so you can bring the training to you, because we know that sending one person off to Sydney or to another region to do training in terms of implementing that in their services is really challenging. So we really do encourage services to apply for that group training, to bring the trainers to you, to engage as many staff as possible. But I think that idea of Lyndon bringing the Cert 4 to a particular region might be something that, you know, that's something tangible that you can go to government and say, actually, this is an idea. This is something that, you know, you can fund and you can invest in. So thanks. I will take that on board, Raechel. That's a good one. Thank you, Lyndon, for the idea. So any other ideas or any other pearls or any things like that, those really tangible things that we can take away? I would be welcome to hear from participants. Okay, well, I won't keep us if the conversation's not going, because I know our time is all valuable. This webinar will be recorded, so if you have other staff that you think that it would be useful, then please do pass it on to your team. And I will follow up after this with to get your feedback around what another topic might be, to hold another type of regional and rural specific forum to bring you all together. And again, anytime you have ideas of things that would be really useful in terms of specific training to regional and rural areas, we're really open to hearing your feedback as NADA members. So I'd like to take this opportunity to thank our panel members for their time today. We really appreciate you articulating the issues that you have and talking about the things that you do to support your clients and your staff in regional and rural New South Wales. And I'd like to thank all of our other members online for the services that you provide. We know that this has been a challenging year, and particularly more so for our regional and rural services and for our own lives and our own communities. So thank you for doing what you do. So that's all. We'll wrap up, and I will say thank you, and have a good break.